Hello, everybody. We are going to start the session now. I would like to welcome everybody and thank you so much for taking the time to be with us. I am very excited about the webinar today because it's our first peer-to-peer webinar. We know all our members have a lot of knowledge about child marriage, and this is the first time they will be sharing it with other members. We really hope this is going to be the first one of a long line of peer-to-peer learning webinars. I would like to first explain a little bit the structure of the session. I am going to firstly introduce our two presenters, and then they are going to go on to make their presentation. While they are making their presentation, you will have the opportunity to ask questions. This can be done by using the chat box. If you look on the right side of your screen, you have a tab that says questions/chat. You can write there your questions. Dr. Gamal and Dr. Lamia are not going to be responding at the questions while you are making them, but we're going to have a Q&A session at the end. But in the meantime, you can already start asking the questions. After they finish their presentations, we are going to see if there's interested in having a short round of people telling us if they are developing a national strategy in their country and how is that going, or if they are interested in doing it. And after that, we're going to move to the Q&A session. So I am going to first present our two speakers and also the organization they work for. As you might know, Pathfinder International has as a mission to advance sexual reproductive health and rights globally by catalyzing change locally. Today we are joined by Gamal El-Khatib. He's the project manager at Pathfinder Egypt, and he's in charge of managing the prevention of child marriage. He also does freelance consulting to Egypt government organizations working in the field of healthcare. He has an undergraduate degree in medicine from Cairo University and has a master in public policy from Boston University. Sorry, he has a master in public health. And Dr. Lamia Mohamed, she has an MD in pediatrics, and for the past 12 years, she has been professor of pediatrics and neonatology at Cairo University. And she has over 50 international publications, presentations, and journal articles in the area of maternal, newborn, and child health. She has been, for most of this year, consulting Pathfinder and helping them in the development of the national strategy. So I am going now to invite our two presenters to start their presentation.
Muted.
Good morning, everybody, or good afternoon. So let me start by giving you a background on what is going on in Egypt. Early marriage is one of the major challenges that impact negatively on the population characteristics of Egypt, particularly on girls. It infringes on the basic human rights of the society, particularly the girls, whether that could be the provision of education or their capacity development, or even their mindful choice without coercion regarding their marriage or their future, and finally, a compatible marriage and the chance to build a healthy family relationship. The current situation says the different surveys put the early marriage between the age of 15 to 18 between 13% and 17%. There is no yet national figure. These percentages can increase in certain localities that can reach up to 40%. Despite sorry, but we're trying to plug in a source.
Unmuted.
Hello?
Yes, hello, Dr. Gamal.
Despite the absence of despite the absence of a national study on this issue, The available efforts and research indicate that the percentage of early marriage is prevalent in poorer governorates and is widely spread in certain geographic areas. Furthermore, it is increasing with an increase in human rights violation practices, inflicting harm on physical and mental health of young girls, including commercial and sexual violations. So we're depriving Egypt from the force of young women, threatening women's health. That's 1 million marriages in Egypt, 2012, with 150,000 marriages per year, early marriages I mean. So it's depriving Egypt from the potential of their women, and at the same time there is no identification cards to the women and their children, leading to the loss of women and family rights. So these are the two main factors of the current situation, which also includes a lot of challenges that could contribute to the prevalence of early marriage, and could be also a result of that of these early marriages. We have development issues or challenges, demographic challenges, cultural and religious challenges, social challenges, financial and logistical challenges, as well as documentation and access to information challenges. So the task that was ahead for us was to develop a national strategy for the prevention of early marriage as a component of the National Population and Development Strategy. The thinking was started even before we could have it as a component of the National Population and Development Strategy, when there was a trend towards actually lowering the age of marriage in Egypt. That's how we call it, going backward against all the gains that has occurred during the past 15 to 20 years regarding the age of marriage and the laws regarding marriage and girls' rights and all this. So based on a partnership between the stakeholders within a comprehensive development framework. I think
Dr.
I have a
Kamal?
problem with the...
Yes, we cannot see your screen. We only see a black screen. Is your presentation still open? Dr. Kamal? Okay, we're having a small problem, and we're trying to get Dr. Gamal. Oh, hello, everybody. I'm very sorry. Dr. Gamal has gone offline, and we're trying to get him back online. In the meantime, it would be great for those of you who are in the line to introduce yourselves. I have a, okay, we have John. I'm going to unmute you so you can introduce yourself, and maybe you can tell us if you're working on a national strategy.
Hello?
Yes, hello, John?
Yes.
Hi.
Yeah, my name is John. Can you hear me?
Yes, we can hear you.
Yeah, I am John, and we are quite new as a member of Girls Not Bright, and so we are yet to put in place a national strategy.
Yes,
so we are here to learn from the experiences of others and see how we can put our strategy together.
Yes, and we know you have launched recently the Girls Not Brides partnership in Ghana.
Yes, Yeah.
Congratulations on that one. So I believe Dr. Gamal is back online.
Okay.
Dr. Gamal, can you hear us? Okay, he's back on the line. We're trying to see why we cannot hear him. Dr. Gamal, can you hear us? Okay, well, in the meantime, I'm going to introduce some of the other participants. We have Benedict de la Taille. I'm going to unmute you, and maybe you can tell us a little bit about you.
Hello?
Yes, hello, Benedict.
Can you hear me?
Yes, we can hear you.
Yes, so I'm Benedict from Pathfinder International, France, and I'm a program manager, and we're supporting Plan in Niger
Muted.
to design the child marriage prevention program. So it's really the beginning of the design of the program, and we are not yet in developing a national strategy, especially because in Niger it's still really sensitive issue, but I was really interested to learn from the experience in Egypt.
Unmuted.
Heard me? Hello?
Hello?
Okay.
Yes, Niger has one of the highest rates of child marriage. Yes, we were hearing you. So it's great that you are working in the area.
It's actually the highest.
Yes.
Yes, so Plan Niger has been working for 2 years in two regions of Niger, but at a really local level. And as I was saying, I don't know if you heard me, but it's really sensitive, and there is a lot of constraint working at national level.
Yes.
And so we are not there at all yet, but so I was really interested to learn from the experience in Egypt.
Well, but in any case, Plan International already has a lot of experience with the work they have been doing in other parts of Africa and the world. Great. I'm going to give the floor now, if she would like to introduce herself, to Jessica Zimmerman.
Hello?
Yes, hello,
Can you hear
Jessica.
me?
Yes.
Hi, I'm Jessica Zimmerman, and I'm at Plan Sweden, and I am the focal point for our BIAG campaign. So I'm on the communications department, so I'm just listening here, hoping to learn some more about the strategies.
And in Plan Sweden, in which countries do you work?
We work, you mean with child marriage or in general? Because we...
With child marriage, the Swedish office,
okay.
which countries are
okay, we've got a project in Pakistan, for example, which I'm going to go and visit soon, so that's why I'm interested in finding out how you're working around these questions.
Great. I'm going to also give now the floor to our colleague Ellen, who has been supporting the Nepalese members and Nepalese government in developing a national action plan, so she can tell us a little bit more of how things are being done there. Hey, Ellen, can you hear us?
Hi, Sol, and good morning, good afternoon, everyone. Yes, as Sol mentioned, the Nepal government is in the process of developing a national strategy to end child marriage with the support of UNICEF and with the support of the National Partnership in Nepal. And they started the process earlier on this year, recognizing, you know, there were different efforts happening, but there was a real need for change to happen at scale and for a nationwide response to look at the different actions that were needed on this issue. So they've gone through a process of the civil society partnership, doing some of the initial formative research and consultations at district level in some of the highest prevalence districts. And these have then been fed into the national consultations where they brought together different stakeholder groups from youth groups to religious leaders to different government ministries, etc. And they're now at the process of pulling together all of the different input from different actors and discussing what the draft strategy should look like. So it's an exciting period, and I think there's lots of lessons to be learned both from this Nepal case and as well as from Egypt. And certainly something which is very useful for other members in other countries.
Hello? Hello?
Yes, Dr. Gamal, can you hear us?
Yeah, I can hear you.
Oh, great. We had Ellen, one of our colleagues, who was telling us a little bit about the experience in Nepal. Ellen, do you want to wrap up?
Sure. I mean, that's a quick kind of overview of the process. They're still in the stage of kind of finalizing at the moment, and I think some of the things that they felt they're actually right now. I don't think that we have any of our members from Nepal on the line because many of them are right now at one of the last national consultations on the draft strategy. But you know, one thing that they felt was really important was that it's something which is owned by the government, by the communities, by the different stakeholders who have a role in implementing it, and that going forward, you know, ensuring that there were different priorities being set and time frames for different actions, but that there was a role for both civil society, government, religious leaders, and that kind of participatory process that they've gone through seems like an interesting example to be learning from.
Yeah, and that definitely links with the case of Egypt, and now Dr. Gamal is back online, and he's going to continue to tell us how the process went, and we're also going to hear a lot about the partnerships they built. So, Dr. Gamal, you have the floor again.
Okay, thank you. Sorry for this. So the first step was the review of literature, where we did a review of the national, regional, and international literature on the prevention of early marriage, as well as presenting the findings for a group of review experts to make sure that all what went on in Egypt was captured. And this is a picture of the number of things examined and the panels that discussed the findings. The second step was to develop the strategy itself, and in order to do that, we had to formulate a general working group. That includes people from the executive government, research councils, national council, civil society, and the private sector. And this group, to be selected, we made sure that it is a representation of organizations, not just individuals who have previous experience in the subject. Secondly, that it balances as much as possible the different economic activity sectors, as well as the private sector, NGOs, and the government itself. From that, the general group, we had a meeting with them to decide together on the process by which we are going to develop the strategy. So we decided, that we are going to subdivide into 4 vertical groups to take. Each will take a dimension from the challenges that we see or that we saw from the review literature. So we had a group that tackled the legal challenges, another group that tackled the technical challenges, that was then subdivided into health, education, and economic development. And then we have financial challenges, social and cultural challenges, including the religious, both Islamic and Christian stance of the issue, in addition to the culture and The total number of institutions that took part in the development of the strategy was 64. A total number of 126 persons took part in the development of the strategy, and 16 different meetings took place. This was essential to create a consensus among different organizations across sectors. This is pictures of the meetings. First meeting, social and cultural. The three meetings, general meeting again, and then parallel to this, we had a conduction of focus group discussion in 6 governorates where the prevention of early marriage rates are higher than the national average, to test the strategies and explore areas that were not addressed before. To make sure that, what we have here and discussing as executives and as persons of management experience and technical experience did not foresee any kind of change within the community. The second thing is that to conduct, after we have formulated the strategic directions, to conduct mass meetings discussing priorities and main directions with the public in governorates where the prevention of early marriage is more concentrated, and it also occurred only in 2 governorates. At the same time, endorsement of the 2 declarations on early marriage from the Islamic Research Forum and then the Egyptian Church. That was seen as very important part that should take place actually during the implementation of the strategy. And these are some of the pictures from the focus group discussions. And these are some of the pictures from the general meetings. And finally, we went into the dissemination of the developed strategy through an inauguration conference where the Minister of Health, who is overseeing the National Population Council, requested the formulation of the National Coordinating Committee for the implementation of the strategy, which means that they have decided, based on the strategy, to take actions to make sure that implementation starts. These are some of the pictures from this. Now I leave the floor to my colleague, Dr. Lamia, to talk about the content of the strategy.
Good afternoon. The vision for that strategy was the establishment of a mature society in which the citizens are healthy physically and mentally and can enjoy the highest attainable levels of education and health. A society that believes in the concept of a strong family, acknowledges equal rights of men and women, endorses the rights of children to develop to their utmost abilities, and appreciates the pivotal role of women in the society. Actually, the strategic objective was to lower the current prevalence of early marriage by 50% at the end of the 5-year plan, focusing more on geographical areas where the phenomenon is prominent or showing an increase. The strategy adopted 2 pillars: the rights-based approach and partnership. The rights-based approach, where boys and girls have the rights that they are ensured by religions, not only the rights that are ensured by religions much before they were ensured by constitutions, and partnership between government, civil society, and the private sector, and the approval of the society, the people, through a specific time-bounded implementation plan. The execution plan relied on scientific results-based planning process, determination of outputs, outcomes, success indicators, and implementation in phases using an applied model. Monitoring and evaluation, and the plan actually started by preparatory phase to finalize the development of integration and financing mechanisms, and to create a mechanism to build the capacity of the human resources among the different disciplines. This could have only been achieved and can only be achieved if Egypt adopts general policies to address the challenges and indicators to measure the impact. Operational directions were based on addressing the key challenges identified from the review of the literature and reaffirmed by the target group in the public. There were 5 very strong components that we had to work upon. First was how to support girls who got married early to minimize the negative impacts on their children, the families, and the society through an inclusive strategy. Second, to complete and update legislations to express the current constitution and activate the existing protection laws. Third, was the development of policies to counter against the pro-early marriage environment. Fourth, empower, educate, and prepare the young girls to address family and society pressures. Fifth, advocate, align, and mobilize the officials, families, and local communities. General policies that were listed in the strategy aimed at integrating existing and future programs, national strategies, and resources in a partnership spirit. And this was mainly through partnership across sectors with clear coordination and partnership mechanisms and different disciplines or sectors of the government, the NGOs, as well as the private sector. Integrating activities across government sectors within the government itself, I mean between education, culture, social services, health, and trying to build the capacity of these areas to be inclusive in involving to the NGOs and private sector in what they do. Again, the general policies included the rights-based design and implementation through ensuring access to preparatory and secondary schooling, through providing needed schools in both villages and cities, towards improving quality of education, tying it to what is needed by the market, tying it to the labor market, and by regular reviewing of the educational process and its outcome, optimizing demand. Address the unemployment through an innovative labor-intensive investments with priorities to the underprivileged, rural, and border areas. Expand the small-scale industries within the different government sectors, providing both technical and financial support to the producing families. Targeting communities to be approached, the target communities to be approached with health and educational subsidy programs, and increase the pension from the Ministry of Social Solidarity and other forms of financial subsidies. Again, the policies included ensuring access of the adolescents, married girls to education and healthcare, as well as empowering the young girls by creating work and income opportunities and increasing the pension from Ministry of Social Solidarity and the other subsidies directly to the victim girls. The policies including a close and tight monitoring and evaluation scheme through utilizing existing platforms of data collection in the government and non-government institutions, especially research institutions, and building on available existing research, as well as developing and follow-up of a wide base of social, health, and economic indicators for evaluation. Close monitoring and evaluation as well necessitates a collaboration between government entities, international and national entities in developing an applied implementation phase, and requires the development and implementation of a clear monitoring and evaluation plan with roles and responsibilities, annual measurement, and public announcement of findings and actions to be taken. Mechanisms of integration were, actually there are various mechanisms. The first was to develop a structure that would oversee work across ministries and organizations, central to coming from down up or up down, I mean at the central level, coming down to the village level through governorate and district levels. This actually needs to create mechanisms of coordination and collaboration between the government, the NGOs, and private sector to smoothen the interaction and the decision making and conflicts as well that might rise. Clear delineation of authorities and responsibilities between ministries and governorates, roles and responsibilities should be very clear, as well as clarification of roles and responsibilities of each level of administration at central, governorate, district, and village levels with relevant authorities to carry out these responsibilities. The second was to prepare the human resources on team and joint work to involve all sectors in the preparation of the plans, outlining all aspects of work at the different levels, of course. Prepare the implementation teams to work out potential conflicts in scopes of work and or authorities to turning them into positive opportunities. And an essential part of the evaluation should be dedicated to the quality of group work, coordination, and partnership to achieve the results. Again, very importantly for integration was to integrate the planning, administration, and finance mechanisms with the technical implementation, a very big problem in Egypt. This is proposed to be done through activation of the required financial authorizations needed to achieve gender equity and guarantee directing allocated finance for women and children empowerment and care programs, not any other activities. Sometimes they redirect the money. Acquaint the technical departments of the relevant service ministries, Ministry of Social Solidarity, Health and Population, Education, with these authorizations to be able to follow up and demand financing for the activities. Work on switching from the item budget to a program-based budget for more understanding of allocated budgets and to bridge gaps for closer work between finance and technical work. Develop an M&E plan that will be integrated into the execution plan was one again of the important mechanisms of integration through assigning qualitative and quantitative indicators to be measured and really pointing out the frequency and duration and clearly delineating them, involve research institutions in the conduction of relevant required data collection, analysis, and review, with regular updates of the nature of information to become more realistic and relevant in measuring progress to the objective. Activate the roles of the National Population Council, National Council of Women, National Council for Childhood and Motherhood in conducting regular research, tabulation and analysis of the data across time and areas to produce trends analysis. Also, the mechanisms of integration included application of rules of transparency and good governance in the implementation of the strategy and its follow-up through institutionalization of the mechanisms of joint collaborative work among departments with an institution across ministries, with documentation of the process and activities. Finally, analyze and improve work process in a collaborative manner, leading to practical improvement of implementation. Gradual implementation at the village level and the areas of the district, and then going up to cover the whole governorate. Teaching them how to accommodate and use the available resources and capacities. Separate execution from monitoring and evaluation, and involving the community, particularly the youth, in the process. Yearly evaluation and declaration of the results at the decentralized level, at the governorate level, as well as the national central level. The execution plan relied on 4 phases. Would you like to continue, Dr. Gamal?
Yeah, fine.
Yeah.
The 4 phases of the strategy, showing sub-objectives and activities for each phase, indicators to follow up the output of the activities and the outcomes. The allocated government line items and budget for the duration of the strategy was also taken into consideration. The determination of the technical and financial gaps also took place so that all operational background is taken into consideration. The first phase was to make sure that the structure and preparation are well in place. So set up structures from the central level to the village level, determine the skills needed and the present gap in these skills, address the needs to prepare human resources, develop and test a full project monitoring plan, including the detailed outcomes or the detailed processes to do that. Second phase is the applied model of action. where an application model in one district is carried out to review and determine most relevant activities for scale-up, test, the monitor and evaluation tools that were produced under the structure and preparation. The third phase was to scale up the implementation from one district and one governorate to 7 governorates and institutionalize the yearly evaluation and dissemination of the results at the governorate and national level. And then start up the midterm review process and action to modify work as needed. And then the fourth phase is to take that up to all governorates in Egypt with final evaluation and preparation for the next cycle of the strategy. So it's a 5-year based strategy to end up with the objective of eradicating or preventing early marriage in China. Thank you.
Thank you.
Thank you so much, Dr. Gamal. Yes, hello, can you hear me? Hello?
Yeah, I can hear you.
Great. Thank you so much, Dr. Gamal and Dr. Lamia, for this presentation. I'm going to invite our guests to write their questions. They can write them on the chat box. And in the meantime, I would like to have you, Dr. Gamal and Dr. Lamia, telling us a little bit what are the lessons learned from this process? What are the advice you could give to other practitioners who are engaging or are thinking of working with the government to develop a national action plan?
Okay, let me start. I mean, first thing is that there must be a process owner. And without a process owner, it is usually very difficult to get to start up or to group the different institutions that should be involved in the process. And that process owner does not mean that they are the boss or they're the ones who are going to develop the strategy and ask others what do they think. It is actually the process owner is supposed to facilitate the process from the selection of the institutions, the representatives of the institutions, and making sure that whoever is still or is seen relevant by those selected to contribute to the strategy is taken into consideration, is invited to the team. I think these are very important things to create ownership of the strategy itself from those who are developing it, and that's I believe a key issue to develop the strategy in a way that is to the people that developed it in a way that they would be willing to implement on the ground.
I think we came out with a very important lesson for us in Egypt that might be definitely applied, that people need to be included, but they don't know how. Because all those who were included with us, I think, discovered things in themselves, and they themselves started asking for more collaboration. And this was very important, and it showed up after finishing the strategy and in the preparatory phases of the executive plan, where the institutionalization was done and MPC took over, and we were just looking from a distance, how these people came back because they were included and they felt that it's there, and they were asking the next steps, the implementation steps, what is going to be done. I think this was really a lesson that we learned as well, because it did not cross our mind that this is what people need, and we never responded to it.
The second thing that I should mention is the fact that, I mean, everybody saw that the point of view of the religion is something very important. But the process of soliciting that feedback from the religious institutions, we learned a lot from it, because we needed to know or to understand how the institution operates and what kind of data should be, and how do you call it, information should be communicated to be able to get the desired or how do you call it, the stand with its proper roots. But for example, let me tell you, if you go and say that there is pointing to a heart, while we have evidence of a heart, the way we present the data, it will come with a different opinion, because they go through a methodology of research and putting that against rules within the religious concepts that are available. So we have to understand this process quite well, so that when we go and approach them, we're not approaching them in a way that will make their message a little bit weak, that would give, how do you call it, mixed messages or things like that.
I think as well, something very important came out, that the governing for people's opinions was not the religion. We thought religion is governing, but we found out that cultural beliefs were the deep roots that were very difficult to change, and that they did not get back to religion to say, well, yes, she should be married early or not. This was good. And to add on what Dr. Gamal said as well, we came out with the conclusion that the technocrats are not doing their homework in addressing the religious people, and they are not giving them the detailed, correct data of the harm that's coming on the society, and in turn, they cannot bring out what helps us in our mission.
Thank you so much for presenting some of the recommendations. We have John from Ghana who has several very good questions, so we are going to unmute him so he can ask directly. John, okay. You will have the floor now.
Okay, thank you very much, and thanks to the facilitators for an insightful presentation. I just wanted to know, the first question has to do with, you mentioned that you are going to, as part of the implementation process, going to set up, I think in phase 1, structures from central to village level. But earlier in the presentation, you mentioned that this was multi-sectoral and also involving several stakeholders. So I would be interested in knowing what kind of structures did you have in mind when you think of setting up structures from central to village level. And so that's the first question. The second question has to do with, how was this strategy development process financed? Was it financed by the government? Did you get funding alternatives to do that, and at what cost? So that new beginners like us who are also thinking of developing a strategy can keep in mind the cost implication. And my third question was, who spearheaded the process? I can see that you are presenting from the point of view of the National Population Council, and that certainly is a government agency. Was it the government-initiated process to put a strategy in place, or like Girls Not Bride movement in Egypt that initiated, or this was initiated by plan? How did it come about? I think those are the questions. The very last one would be, we would certainly be interested in the key issues that you will advise us to keep in mind as we go through a similar process to develop a strategy. Thank you.
Thank you, John, for those very, very interesting questions. And we're going to let Dr. Gamal and Dr. Lamia reply now.
Okay, for the approach, the central to village approach, involving the structures will be involving the local authorities that are present at the decentralized level, local authorities from education, from health, from social solidarity, and these are already present there at the village level, at the district level, at the governorate level. The challenge is how to create a mechanism of inclusion with this government group, involving NGOs and private sector to be included in that group. That is the challenge. But the local authorities are, usually they sit together and discuss some things. But this is the first time that we are asking them to involve NGOs and private sector and to discuss a deeply rooted cultural problem, not only to discuss it, but work on its reversal. This will continue at the district level as well, the group of authorities, and then at the governorate level, to come up with the plan for this specific governorate, because there are different cultural sensitivities between the different local environments, and all this will go back to be implemented in the national plan at the central level.
So the idea is that it's empowering a process that has not taken early marriage as an issue before. So that's the idea of the structures that we had in mind. That's why we included the mechanisms of integration and put a lot of focus on it. So the idea is that for them to look at not working alone, stand alone as different ministries, because you will find programs of subsidies, for example, that are available in the Ministry of Social Solidarity. You will find platforms actually for health education and for education and public education on these issues in the Ministry of Agriculture, in the Ministry of Youth, in the Ministry of Education. So empowering all existing structures to work together, it provides a whole different set of, how do you call it, of impact on the population that is different from each organization or each ministry working alone. The second thing, as Dr. Lamia said, including private sector and NGOs, and these mechanisms were not known to the government, and up till now is still based on, how do you call it, individual initiative rather than having mechanisms. So these are the kinds of structures that we had in mind when the discussions were carried out in the different rooms while developing the strategy. The second question, which is who financed the development of the strategy? Well, it was co-financed. They received, NPC is the main financer of the whole operation and the process owner. But they received assistance from a donor agency, and that brought in some of the technical assistance that were given to the National Population Council for facilitation purposes. Otherwise, the how do you call it, the focus group discussions that were carried out, the public meetings, the invitation of the government and the private sector as well as the NGOs, everything was carried out by the NPC itself.
And the important thing that this process of strategy development was including capacity building to MPC people, to the MPC workers, those who work at the MPC, because we thought that to have proper inertia, to give a push, the implementation should start immediately with the end of the strategy. And it should start with people working on MPC. And every phase in the implementation plan, we included the administration, the planning, and the financial authorities in the Ministries of Finance and Planning to make sure that money is available for the activities in the implementation plan, and to find out that there were gaps. I mean, some activities already were financed by the government, but maybe the finance was not used in that activity, it was redirected. So we have to have these people to make sure that the money allocated for these activities go to these activities. And the gaps, some gaps were found out. Everybody in the government was sitting, trying to find out who can finance, maybe through NGOs, maybe through international organizations at a certain point. Nevertheless, the implementation plan throughout the 5 years will be mainly covered by the government of Egypt.
And again, who spearheaded the process? It was the National Population Council who spearheaded the process. So now, key issues to keep in mind. Actually, the lessons learned that we discussed, I don't think we can add, I don't have in mind, and right now in my mind, something else apart from the lessons learned.
Thank you so much, Dr. Kamal and Dr. Lamia, for your reply. I would like to know if there are more people in the room who have questions. And in the meantime, I have a question. You are talking a lot about bringing the private sector. And I would be most grateful if you could give us some example of who is the private sector that is interested in engaging in a national strategy on child marriage. In the meantime, if anybody wants to ask a question, you can write it on the chat box. Yeah, sorry, Dr. Kamal, you have the floor now.
Okay. Who from the private sector is interested in the issue of early marriage in general? No, as such, no. But they are interested in issues or very focused areas like education, for example. A lot of the private sector is very much interested in contributing to the education. But what they need is what kind of programs can they participate in, whether by volunteering or by putting in money to help co-finance the schooling, especially in the very remote areas, so that, I mean, if the solution is clear to them, they are more than willing to participate in that one way or another. And there are so many of them, particularly in the area of education. The second thing is the economic development. Their understanding of what are the, how do you call it, the hot areas, and whether their impact, to what extent their impact, if they invest in certain areas to put up factories or even to finance small-scale industries, it makes them, it shapes up their decision to where they would invest. Okay, but this part of the discussions is that please develop all these for us and invite us when you have a clear plan, and that's typical of private sector. They need a business opportunity that is well formulated, even if they are going to do with it social good.
Thank you so much. That's very good to know. Yes, it definitely did, and I think it's something to keep in mind for the people that are working at the country level. I am going to invite Ellen, who has a question. Ellen, can you hear us?
Yes, thank you, and thank you for the really interesting presentation. I was just really interested to hear about the lessons learned from what you were saying about ring fencing different line items in program items for this work. And I'm just curious to hear, did the strategy increase the finances available for this work, or was it a case of securing the intended allocations? And also, how has it been working in practice so far, or is it too early to say?
Yeah, okay. I mean, this is very tricky, the financing part. I mean, let me tell you, the current situation is that most of the budget is done by line items. So line items, we mean a line item for putting up buildings, for maintenance of buildings, for human resources, I mean salaries and things like that, for general operating costs. So you can spend that on any kind of program, and you can distribute them according to the ledger of the person in charge of that particular program or department. Okay? Now, the Ministry of Finance started a process whereby these line items are turned into program items. So there is a phase to where you're spending part of your operating cost, part of your salaries, part of all this. The idea is that there is also a mechanism, because usually, for example, if you go to the Ministry of Health, they would say, we would like family planning, vaccination, all the money. So we're now short in, for example, finance and maintenance for the cars to go and do vaccinations. So we will take the money allocated for child protection, for health education regarding early marriage, girls' education, and things that actually contribute to the health of the girl, okay, and put it in this. Okay, so there are mechanisms within the Ministry of Finance that are called authorizations, signatures, which protect these line items from people doing that to them. Unless the program officers know about this and contribute in budgeting the money that is allocated to this, that will not happen. And that's what's currently happening. That the program officers know about the budget when it is done. They are not included in the process of the plan. And that's one major change that needs to be tackled. And that's the first thing put in the structure and the preparation phase. Because unless the process is carried out properly, the finances will not be guaranteed and will not be changed from the budget.
I would like to add that, again, most of the activities are actually to combat poverty, to combat educational dropouts. These activities have finances allocated to them, but never ever did the government officials try to make use of this finance for the same issue, the cultural issue. Okay, they didn't look at that from that point of view, and this came out, and they discovered they do have money. At the beginning, they said we don't have money for these activities, but throughout the process, they said no, we do have the money. Maybe it's not enough, and money that is allocated directly to women and child issues, which is not a lot, we admit, is redirected. So they knew two things: that they have money to do a lot of the activities, and that they have the right to ask for the money directed particularly to these activities to add to what they have.
Thank you so much for your response. And hello?
Yeah.
Yes, and we're about to finish this webinar, but before we say goodbye, I'd like to ask a last question on what are the next steps in the process and for you for Pathfinder.
Okay, I mean, MPC already initiated the process of formulating structures and inviting people for the implementation, and took certain steps within and with some of the line ministries to start the implementation. They are working with us now so that we can help them with the process of how do you call it, implementing the model in one district in a governorate. And that would be this is one of the major technical gaps that is required by MPC. So they are working with us to make sure that finance is available to do that and for it to be carried out, and that would be a pivotal incident in the advancing of the implementation of the strategy.
Thank you so much. This has been a great learning session. We have seen the challenges that are particular to the Egypt case and some of the solutions that working in partnership has been able to bring about. And I think it could be replicated and, of course, be adapted to different contexts. And I really hope our members have learned from this experience and will be able to implement some of their recommendations. It is also encouraging to see that there is money, that there is interest from the private sector, that is not the easiest to engage with them, but it is possible. And I believe we have Dr. Kamal's presentation, so if anybody is interested, we would be able to share it with you. And of course, we could put you in touch with Dr. Kamal and Dr. Lamia if you would like to ask some questions. And I would like to thank them very much for taking the time to prepare the presentation, to be here today, and to share all their knowledge. And I would also like to thank all the participants for being here. So thank you so much, and I wish you all a very nice afternoon.
Thank you very much.
Thank you. Same to you.